So that sits onto a shaft, which you can see goes up.
A hip replacement for a dog is a pretty serious procedure, and there's some pretty serious equipment involved, as ARH surgical specialist Dr. Sarah Goldsmith explains.
It stabilises onto there. The good, and then you lose your head, and it's just all gone.
It is seriously interesting.
Want me to get it?
Hip replacements are amazing, but how are they done? In this short video, ARH surgical specialist Dr. Sarah Goldsmith briefly looks at some x-rays of a deformed hip. Then you'll see an amazing device called the Kion that literally replaces the actual joint itself.
So we're talking about Wilson today. Wilson is a golden retriever. This is his more normal hip. It's not perfect, but here's his hip joint, the round ball part of the joint sitting in the cup. Reasonable coverage. It's not particularly normal because it isn't very, it's a bit round, it's not so rounded, it's a bit flattened, but this is abnormal. So you can see the difference between these two sides. This hip joint isn't really even sitting in his cup, so the ball part of the joint here is misshapen. It's not nice and round. It's got a little kind of bony point on it, and it doesn't even sit in the cup, so it's kind of not even relating to its normal joint. So a normal hip joint, this is how it should look. He should have a nice ball sitting in his socket, and it should fit in there, so most of that ball is covered by that socket and they have a good range of motion. What happens when they get hip dysplasia is it's really shallow and the head doesn't fit in properly, and it tends to pop out or move in and out, initially just partly and then fully out. If you leave hip dysplasia a really long time, you can end up with really severe changes to the joint, so that it's really crunchy when you move it, really painful. In his case, it was getting like that even at 8 months of age. It was really sore. So we needed to do something about it. We needed to give him a new hip. So the hip system that I use is called the Kion hip system. Kion is a company from Switzerland which produce beautiful equipment. We use a lot of their orthopaedic equipment. And what we do is fully replace the cup as well as the ball part of the joint. So here you can see what happens to the pelvis. We take the normal acetabulum, we ream it out and put a new cup in. So the cup's lined with a special plastic lining, polyethylene lining, and if you can see there, it's got titanium as the shell. So the titanium shell has got like a honeycomb pattern on it that allows the bone to grow into it. So that actually becomes part of the whole pelvis by the time we're finished. So the bone grows in and that forms part of the pelvis. So we have a beautiful cup part of our joint. So with the femur, and I seem to have lost the bottom half of my femur, but you get the idea. In fact, you can see the implant better because of that. So what we do with our normal hip, we cut the ball part of the joint off, we take the ball part off, so that's gone, and then we replace it with a titanium ball. So that sits onto a shaft, which you can see goes up the inside of the bone and is actually screwed in place. So all those little screws go through the back of the bone, through the implant, like a plate but inside the bone that stabilises onto there. That means it's stable. It's like a plate inside the bone, so it's not going to go anywhere. Much better than the cementless systems that don't have them screwed in, because you're relying on it just press fitting in and there's often a bit of instability, but this is stable straight away, which is really good. The titanium head fits on. It's actually got a special kind of Morse lock, so we'd have to hammer that on to make it fixed, otherwise it'll fall off. So that kind of fits on there, and you can change the length of that depending on how far it has to fit in, and then we put it together. So these are the radiographs of Wilson after surgery, so immediately after surgery, just before we wake him up after the theatre, after he comes out of theatre. So this is the side-on view that we took before, but now he's got the new hips, so we can see the titanium. The plastic doesn't show up, so we only see the titanium. So the titanium shell here, the head sitting in the cup, and the neck there, and then this is his implant going down. Remember how that goes, that way, goes down the stem, and all the screws you can see are fit in nicely coming out of the bone. That's how we want it to look. So I'm happy with that, that looks good. Here's the other view that we were looking at before, a similar view, looking through his pelvis, straight through like that. Again, here's this nice cup. We can see how it matches the other side, so it's back in the normal position. The head's back in this place that we want it to be sitting in the cup. And then we've got the stem going down and all the screws coming through. So again, I'm happy with the position of that. So Wilson ended up doing really well on his first hip, but then 3 months after the first hip, his second hip, the other side, became a problem for him and he became more lame. And we ended up having to do a second hip on him, which at least gave him even back legs. And he did very well with his second hip as well. And we've got some image here of him trotting around with both his hips done about 3 months after the second hip, so 6 months after the first. But he's a much happier dog. Before, when he was 6 months old, when he first came to me, he was not wanting to play. He'd sit down all the time. He was really miserable. Now he's a happy dog. He can play with other dogs and he's running around, going for walks, very happy.